Now I am inviting our second speaker, renowned facial-maxillary surgeon, Dr. Shrish Dubey, whose topic is on dental implant. Dr. Dubey, please come forward, sir.
Good morning. I am Dr. Shrish Dubey, and I'll be talking about dental implants, which represent a paradigm shift in how we restore and replace missing teeth. Now, when we talk about lifestyle to a person on the street, the first thing which comes to their mind is roti, kapra, and makan. Roti, ghee lagi hai ki nahi? Kapra, whether it is branded, unbranded, what brand, and makan, how big a house you have. But when a healthcare provider hears the term lifestyle, the only thing which comes to our minds are heart attacks, cardiovascular events, osteoporosis, diabetes, hypertension, because the present lifestyle has a lot of issues in it. Sugary drinks with high carbohydrate content, alcohol, smoking, all of these have increased the incidence of a lot of diseases, but they also affect our teeth. We talk about oral cavity as the guardian or the entry point of the body. But we have to remember that whenever there's an attack, it is the guardians who get affected first. So why are teeth important? Remembering Guyton from our physiology days, we realize that digestion is a surface phenomenon. Thus, the smaller the particle size of the food that we eat, the better digestion is going to be. Another thing is that the smaller the particle size, less chances of excoriation or damage to the walls of the GI. Our teeth are made for chewing. The front teeth are made for cutting, canines for shearing, and the molars for chewing. All of the teeth in combination we need in order to have a good eating habit. Also, as we eat, the salivary glands secrete saliva, which is very important. Chewing will help us to mix the food with saliva. Saliva contains amylases which help in the digestion of long-chain carbohydrates, as well as mucus which helps to improve the movement of food bolus in the GI. Another aspect of teeth is aesthetics. How much do you think this person is going to smile and laugh in a social gathering? Confidence and aesthetics are, in today's world, a very important factor of our life. Speech, teeth, tongue, and the palate are very important in molding the voice that we use. And speech and communication are affected whenever a teeth is lost. Teeth also support our lips and cheeks, and missing teeth will lead to sunken appearance of the cheeks and the lips. Oral health is interconnected with general health as well. Poor oral hygiene and dental problems have been linked to various conditions, including cardiovascular disease, diabetes, respiratory infections, and adverse pregnancy outcomes. It is all the same thing with stress and inflammation. The regular line is that an apple a day keeps the doctor away. But if somebody doesn't have teeth, will they be able to have an apple? A diet with good nutritional profile has to include fruits and vegetables. But without adequate teeth, we will be unable to chew properly. Teeth also help in maintaining the strength of the jaw bones. As teeth are lost, the jawbone starts resorbing and becomes weaker with time. For example, this is a patient who came to me. She had lost all her teeth around the ages of 35 to 40. By the time she was 65, wearing a removable denture, almost all her bone of the mandible got resorbed. This mandible is less than 5 millimeters thick. So you can just imagine, even the slightest trauma to the face will lead to a fracture of the mandible. And in such a thin mandible, if we try to repair it using a plate or screw or any other form, the chances of it leading to further damage is much higher. Teeth, of course, also play an important component for maintaining general oral health. Suppose a teeth is lost because of cavity or any other factor. Once the teeth is out, the bone starts healing over there, but there's also bone loss, not only in that point, but also in the adjacent teeth. Again, as time goes by, the body tries to fill up that gap on its own. This leads to movement of the teeth around it as well as the teeth on top, which leads to further bone loss around those teeth. Also, this positioning of the teeth will make it more difficult to clean them, leading to greater plaque and calculus deposits, greater gingivitis, and oral disease. Also, it will change the way we chew food, and will further lead to temporomandibular joint disorders as well. It will also cause fractures of the enamel at the cervical regions as well as further grinding of the teeth, making the teeth which are left more damaged. So what is an implant? Any tissue or artificial object that we place in a patient's body is known as an implant. A dental implant are basically devices which we fix to the jaw bones in order to replace missing teeth. We use them to fix artificial teeth or crowns or bridges and dentures to the jaw bones, thus giving a fixed replacement for the teeth which are missing. A dental implant system basically consists of three parts. One is the implant body itself, or the fixture which is placed inside the bone. The other is an abutment which connects the implant with the crown or the top part which is visible in the oral cavity. Now, implants as a concept and the role of missing teeth is not something new. Civilizations like the Mayan civilization of around 600 AD also attempted to replace missing teeth using implants. They made implants using shells of sea creatures like oysters, and they were placed into, a drill was made into the mandible, and these teeth were placed there. From 1500s to 1800s, in Europe, a lot of poor as well as cadaveric teeth were taken and attempted as an allotransplant in richer people. Numerous substances were attempted to replace teeth like silver, gold, iridium, porcelain, etc. However, the modern system came into being with a paper published in 1978 by Professor Brandmark. He was an orthopedic surgeon who was studying the effects of the implants used to fix fractures in long bones. He found that when he was trying to remove titanium screws, he noticed bone deposition on the screws at the long bones. He realized that these may also be used in the jaw bones in order to attach teeth to them. He gave the first publication in 1978, which was very well documented, with a history of 13 years. The first patient in which he placed these dental implants was a patient with severe facial deformities and congenitally missing teeth. But we have a history of 40 years that those initial implants lasted. He had a saying, "No one should die with their teeth sitting in a glass of water." So how are implants placed? First, we place a small incision on the gums, expose the bone. If required, we can flatten the top part of the bone a little bit. Then using drills of increasing size, we ensure that we get the right size for placing the implant. Once the implant is placed, then we close the gums and let the bone heal for around 3 months. In 3 months, the process of osseointegration, which is what the modern implant system is based on, happens. In osseointegration, bone is deposited on the implant and becomes a one with the implant. After 3 months, we expose the implants and give the replacement or restoration on top of it. For a single tooth, we can give a single crown. If there are multiple teeth missing, we can use it as a bridge and give multiple crowns on it. If the entire jaw is, if no teeth are present in the entire jaw, we use something like 4 or 6 implants to replace all the teeth together in a hybrid denture. For example, in this case, the molars were not there in one side, which was leading to a lot of problems on the other side. So we replaced the molars with 2 implants, and the quality of life increased drastically. One problem with teeth loss, as I have said, is loss of bone. This is especially seen in the maxilla, where the sinus starts moving down and eating up into the bone where the tooth was once the tooth is removed. Earlier, there was no way that we could have replaced these teeth. But nowadays, with good quality artificial bone grafts and good techniques, we can do this very easily nowadays. So like for example, in this patient, the first molar was missing, but we had only around 3 mm of bone present. But placing an artificial bone graft, we were able to give an implant, and this is like around 1.5 years later, and you can see the additional bone that has formed around the implant. Another problem with the maxilla, as I said, is bone loss. In the previous case, we had around 3 mm of bone, but in a lot of cases, even that much bone is not present. Sometimes we get down to something like 1 mm or 2 mm bone. In those cases, we now have things known as zygomatic implants, where we take support from the zygoma, which is the most strong bone of the facial skeleton. Like for example, in this case, we had around 1 or 2 mm in the posterior part of the maxilla. So we use zygomatic implants in order to replace the entire arch. This is a recent case, so I don't have the post-operative once the replacement is done, by around another 1.5 months, we'll be giving her the teeth. This is just a small video showing like how do we do the zygoma implants. With new local anesthetics, something like this, which was earlier supposed to be only done in a major OT under general anesthesia, now we can do it in local anesthesia with minimal discomfort to the patient.
Another 3 minutes more.
So in conclusion, I like to say that replacement of missing teeth is an important component of the holistic treatment of a patient. So when a patient comes with diabetes or hypertension and we ask them to improve their diet, we ask them to have fruits and vegetables. But if they do not have teeth to chew, how will they be able to have them? Dental implants are the best treatment option for missing teeth. We used to use a lot of removable dentures earlier, but with increasing life expectancy, increasing dementia, increasing Alzheimer's that we see today, in those cases, dentures and removable materials inside the mouth are not really possible. And the quality of life which an implant will give compared to a removable is humongously different. And of course, with the newer techniques and materials we are now have, it is much easier for us to provide implants, even in those cases where earlier we had to say that no implants were possible. Thank you.
Thank you, Dr. Dubey, for your brilliant presentation. Dr. Dubey is doing a wonderful job, and he is the newer group of faciomexillary surgeons who are taking this subject to a different level. Thank you, Dr. Dubey. Now I request our eminent chairpersons to felicitate our young Dr. Dubey. Thank you very much.